Hello.
Hello.
Hi. Thank you for being here today. This presentation is on falls and hourly rounding. It shouldn't take more than 10 minutes or so out of your time. My name is Anca Pruette. I am a student at Northwest Florida State College in Niceville, Florida. And I am also working as a registered nurse here at the hospital. I've been on the cardiac floor for almost 2 years. During the clinical hours that I had done for school here at the facility, my preceptor and I have identified that falls is a huge concern and a growing concern throughout the hospital. So looking at the literature that it's available and on falls and call light use and interventions that can be used to decrease these issues, I have come up with a PICO question that it's used at the base of any research in nursing. And it goes like this. Does hourly rounding by nursing staff reduce the number of falls in hospitalized patients compared to current practices of rounding on a as-needed basis? As we all know, falls can cause physical and emotional damage, like with any life experience, good or bad, especially bad experiences will teach us to be more cautious next time we encounter the same situation. So when a patient experiences a fall, fear will restrict their activities and will make them become more weak, thus increasing their risk for falls. And besides the fear, there's also their medical condition that put them in the hospital, medications that can also contribute to their weakness and confusion sometimes. Inpatient falls are considered to be hospital-acquired conditions, so Joint Commission came up with a fall risk assessment scale that has to be done on admission on each patient, and based on the score, the nurse and the nursing staff will have to come up with interventions in a plan to include in their plan of care to avoid falls. Joint Commission reported that inpatient falls are one of the most reported accidental falls, and more than 20% of patients that fall suffered some kind of injury. And the average increase in a hospital cost for a fall that resulted in a serious injury can come up to $13,000, and it can extend the patient's hospital stay by 6.27 days on average, and this is for the serious injury. And also by the year 2020, it's predicted that the costs for treatment of falls, inpatient falls, can exceed $54 billion that usually the hospitals have to pay for. There are hundreds of studies out there, probably thousands, that were done on falls, call light use, the reasons patients use call lights. But I picked 2 studies for this presentation. The first one is conducted by me, Garcelle, and Kettleson. It was done on 27 nursing units at 14 hospitals. It was a 6-week study, and it measured the effects of rounding at different intervals. It was done at 1 hour and at 2 hours. Although both interventions showed better outcomes, the hourly rounding showed a 50% decrease in patient falls and about 38% of call light use. The second study I chose is the Stutter Group study. It was conducted on 63 nursing units in 22 hospitals, and they noted that a patient uses their call light about 12 to 15 times a day, and it takes about 4 minutes for the issue to be resolved for the nursing staff to respond to the call light. And this actually hourly rounding implementation could save staff 166 hours average a month. So you get to organize your time more efficiently, less interruptions. Just a few numbers about Bay Medical Center. It is a 280-bed hospital. As of June 1st of this year, there were a total of 106 falls hospital-wide. Out of this total, 24 of the patients that fell experienced some type of injury, and about 46% of these falls happened during toileting. So some pros about hourly rounding, it showed a decreased call light use, which in turn will decrease the staff interruptions, allowing for a good flow for the workday. It also, by hourly rounding, it will allow the nursing staff to check on the patient's status and assess their needs, as any of these can change unexpectedly and with no warning. So more frequent check on the patient's status would increase patient satisfaction, and we could provide better care. It's also very reassuring and comforting for the patient and their families, especially knowing that somebody's going to check on their loved ones frequently. So purposeful hourly rounding should be performed between the hours of 6 a.m. and 10 p.m. hourly, and between 10 p.m. and 6 a.m. every 2 hours to allow for some rest for the patient. Also, nurses shouldn't take this whole task upon themselves. We all work as a team, so in the morning after a report, every nurse should get with their CNA and discuss the plan for the day for the patient, and also decide who's gonna round on even hours, who's gonna round on odd hours. And so the workload is decreased. The nurse doesn't have to think that I have to go in the room every hour, I don't have the time. It's gonna be every 2 hours, and actually the rounding will be done hourly with the help of the CNA. So the way it should flow, the hourly rounding, when your first interaction with a patient, you go in the room, introduce yourself, explain what hourly rounding is. So I'll go in the room and say, hello, Mr. Smith, my name is Anca, I will be your registered nurse today. Here at Bay Medical, we do hourly rounding. We like to check on our patients and make sure they're safe and they have everything they need. After the introduction, the nurse can go by completing his or her tasks, scheduled tasks, passing medications, checking on the IV pumps, make sure the right medication is infusing, checking on the IV, help with feeding if needed, any dressing changes. The next thing should be assessing the pain and establishing a pain goal with a patient, whatever is bearable and is tolerable for them. And also that pain level can be written on the board in the room. Also inform the patient of their PRN medication, what they have available, and when the next medication is due, so they won't have to call and ask if it's not time for it yet. Next thing would be to assess position, which if it's breakfast time, you can assist the patient to the chair and get them ready for breakfast, clear their bedside table, assess personal items, make sure call light is in reach, phone, water. If patient is NPO, make sure you clear, you take the water away, you let them know, and inform the patient about their plan for the day, about the procedures they are supposed to have done, any tests, ask them if they know what those tests are. It happened several times where I would tell the patient, oh, you're going for an echocardiogram today, and they had no clue about it. So this will reduce anxiety, and it will let them know that we know what's going on and what the plan is. And also assess the need to use the bathroom, and don't just ask, do you need to go to the bathroom? Offer to take the patient to the bathroom. And before leaving the room, just instead of saying, call me if you need me or when you need me, reassure them that somebody will be back and check on them within the hour, and that ask if there's anything else you can do before leaving the room. So, of course, with any change, there's barriers, and some people just don't like change, so they will be opposing to anything, any new ideas. So, good planning and training is very important. Also, another barrier is staff inconsistency in performing the task, the new task. People are not on the same page. Workload and acuity of patients could be another factor that could interfere with this implementation. And also, multiple recent changes might just seem overwhelming to the whole staff. So good planning, training, communication, and implementation are required elements for change to take place and be successful. So the hospital could use some welcome cards that could be placed in a patient's room, like there's now housekeeping cards, and it would just say, welcome to our hospital, and it will show rounding. It will provide rounding on our unit to ensure you receive the best possible care, and then we round every hour between 6 a.m. and 10 p.m., and every 2 hours from 10 to 6. And of course, if they need anything else after you leave, they're more than welcome to call us. This would be in the form of a little card, not a page, a little card that would be placed on the table. So, and also to help the nursing staff, the hospital would come up with a checklist, a hourly rounding checklist, just to kind of have as a reference if needed. So, I will provide you with bullets of my presentation here, and also the references that I've used for this research. So anyway, any questions? Anybody? No? Okay, well, I'll be here for another half an hour. If you have any questions, please let me know. Any suggestions, feedback, you're welcome to